Hi, welcome to Talk of the Town. I'm Justin Riley, and my first guests are from Verona Vision Care in Verona, and I have Dr. Tami Hunt and Dr. Emmylou Wilson joining us today. Welcome to the program, guys.
Thank you, Justin.
Great to have you. So, tell us a little bit about Verona Vision Care. What's the history? When did you get started? How long have you been in business?
Sure. We started in December of 2006, and then we grew enough to add Dr. Wilson in 2010. And a couple years ago, we moved across the street from where we were currently into our current spot at 320 South Main Street. And we have 7 full-time employees who have been with us for quite a few years now.
Awesome.
We are primary care eye doctors primarily, but we also do specialty exams such as kid exams of all ages, all the way down to infants. We do specialty contact lenses, and we do emergency eye exams for people who have things like pink eye. I think what sets us apart a little bit is we really like to make our patients feel comfortable in our office, feel like a part of the family, and have a good time, have fun while they're with us.
Absolutely. Well, that's good, because I think it's one of those things that people don't necessarily look forward to, but if you can make it a little less uncomfortable.
Exactly. That's how we feel.
Yeah, absolutely. Well, that's great. So now, obviously, I'm somebody who has, been to an optometrist at some point. But if somebody has never been to an optometrist and they feel like, oh, I see fine, can you give somebody like that a good reason for coming to get an eye exam?
Sure. Well, at Verona Vision Care, our eye exams are more than just your vision. We want to check a full health exam, make sure that everything's looking good inside your eyes. We can look for eye diseases. We can look for systemic diseases that might be affecting your eyes. Things like side effects of medication, stuff like that, more than just that. Many of the eye diseases that can affect your eyes, like glaucoma and things like that, don't have any symptoms at all. You wouldn't feel any pain. You might not even notice a change in your vision. So we want to catch that before it's causing a problem for your eyes.
It's kind of one of those things where you should go to the doctor even though you don't feel sick.
We want to catch it before you feel sick.
Right, absolutely.
And even if you're young, you still can be at risk, because we've had many patients who have come in and they feel like, oh, I might need a change in my prescription, and they've had glaucoma or even an eye tumor or something more than just a glasses prescription.
And they never even realized it.
No, they didn't know that they had anything going on.
Wow. So how often should somebody come in and get an eye exam?
Well, the American Optometric Association recommends starting from 6 months to 12 years. That's the first exam.
Really?
There's a program called Infancy, and we are providers for the Infancy program. It's a free exam between 6 and 12 months, and we do everything we would in a normal exam, but obviously the child's not telling us anything besides following our lights, and we're looking at everything. And then the next exam is at age 3, and then before they go to school. 80% of learning is done through sight, so obviously it's very important to make sure they're seeing us properly. And then every 2 years, if you don't have any symptoms or if you don't have any risk factors at all, until age 60, and then after that, yearly exams are required.
Yes.
Yeah, and we do recommend yearly eye exams, obviously, for people who have other diseases such as diabetes or high blood pressure, if you wear contacts, if you're on a medication that might have an ocular side effect. So there's a lot of people who'd want to get an eye exam every single year, even if they're under 60. So
absolutely. And you mentioned contact lenses. Is that something that that anybody can wear? Is anybody who wears glasses a candidate for contact lenses?
Most people can. Oftentimes parents ask us, how young can our child be when they start wearing them? And we feel as long as the parent feels the child is responsible and the child is willing and wanting to wear contacts, it's usually a good fit to start wearing contacts at that point. We've had young kids who wear them for certain activities such as dance or certain sporting activities that even if their parents help them out a little bit with it, it still can be a really good fit.
Yeah, and we have contact lenses for all types of people. If you have dry eyes, they make special contacts for that. If you wear bifocals, we can do contacts that can allow you to see both distance and near with the contact lenses. And we do all kinds of specialty lenses for eye diseases as well.
Awesome. And you guys do lenses, but you also have a selection of frames there.
We do. We have over 1,100 frames in our optical, and we have frames for infants to adults. We have sizes for small heads, large heads.
We have very unique brands too, and sunglasses, specialty sunglasses for any activities.
Awesome. Well, Dr. Tami Hunt and Dr. Emmylou Wilson, thank you so much for joining us today. These two are from Verona Vision Care. They're on Main Street in Verona. Go check them out. Don't go away. There's more Talk of the Town coming up right after this. Stay tuned.